All right, welcome back to Veritas Live. I'm Demetrius Malbro, and I'll be guiding us through today's episode where we're diving into the evolution of healthcare technology and also the rise of cyber attacks within this essential business vertical. Now, as usual, let us know where you are watching from, also by typing that into the chat window. So wherever you're from, India, Asia, Africa, let us know. We love to see where you are. Also, we welcome all of your questions in the chat as well. So please be interactive. We welcome conversation and questions in the chat box. So before I introduced our guests, we want to take a moment to celebrate 2 successful seasons of Veritas Live. Now, this show has evolved in so many ways over the last 2 seasons with multiple hosts and also topics from how to recover from ransomware to skills to pay the bills. And so the success and also impact of this show would not be possible without our amazing audience like you, who has helped us guide our content and provided great engagement along the way. So, if you haven't had a chance to take our LinkedIn poll on our top show, please do so. With the link, the link will be in the comments as well. So please click that link and take that poll as well. And now I'd like to introduce and welcome Richard Staynings, Chief Security Strategist, Cylera, and also adjunct professor at Denver University. Welcome, Richard.
Thank you.
And also our very own Tim Burlowski, our global Product Cyber Resiliency Lead here at Veritas. Welcome back, Tim.
Thanks. Thanks for having me on.
All right. So you both know, as a little bit of an icebreaker here and also to kick things off, you're both thought leaders and also public speakers out in the community as well. So what's one thing you would do before you go on stage or in front of a camera to get warmed up and to also present or give a keynote address? Richard, how about you?
Well, I'd probably check my appearance, make sure the hair was being rather tamed and the tie was done up. If I had speaker notes, I'd obviously make sure I'd shuffle those before I walked on stage, although most of the time I don't use speaker notes. So I tend to ad lib or talk off a slide. So that's my approach anyway.
Okay, absolutely. You have to make sure the hair is in place, especially I'm losing mine on this side, but I'm not ready to go bald yet, but I'm thinking about it. All right, Tim, what about you?
Well, thanks for rubbing in the lack of hair, Richard. I don't do much in that department. If there's a private room or a little bit of a green room, sometimes I'll let out of a little bit of a howl or a yell just to kind of get all the nerves out of my body. It's a little weird, so if I don't have that, I'm not going to do it. But it does help get the body ready for that experience.
So Tim, is that what I heard the other day when we were like?
No comment. No comment.
All right, thanks for sharing. And also, please, audience, remember, interactive session, type your message in the chat window, and please ask us questions because we'd love to answer them. And also to move things along here, why are hospitals so vulnerable to attacks? So let's start off with that. Richard, what about you?
I think our healthcare systems, certainly in the United States, but globally across the world, have really been designed from a technology infrastructure perspective to facilitate access by clinicians to IT systems whenever and however required, right? There wasn't an awful lot of forethought that went into perhaps looking at things from a zero trust perspective of who needs to access what systems at what time from what locations. And there wasn't an awful lot of segmentation of those networks, if any at all, to be honest with you, compared to other industries. So, for example, if you were a teller in a bank, you would have access to 2 or 3 different applications, and you would have access to certain types of data. You wouldn't have, as a teller, you wouldn't have access to trading systems or to FX systems or to other systems that were outside of your job description. Yet, as a nurse or a doctor in a hospital, you have access to just about everything that you've been provisioned for. And this leads obviously to questions around the segmentation of access, around the segmentation of access to data, and also the object level access to data from different systems.
Okay, awesome. And Tim, do you have anything to add there?
Well, I just think it comes back to what are the primary motives of a healthcare professional? And often healthcare professionals were a big part of administration and budgeting for hospitals. So what's their primary motive? It's all about protecting the patient. No one puts a billboard for a hospital on the highway that says, we'll keep your data safer. They're much more concerned about keeping you alive and well. So I look at it as being an incentive question. But times have changed and people have hardened their infrastructure to some degree compared to a decade ago.
I love that billboard statement. I never thought about that. And also in the chat, I noticed that people are watching from India, from Canada, and South Africa. So I almost predicted that. But thinking of a prediction, I have a Gartner prediction for you. So, and that prediction is from this year, and it says that by 2025, a lack of talent or human failure will be responsible for over half of significant cyber incidents. And wow, that's a hard-hitting prediction. So this brings me to, what are the top 3 areas of focus for healthcare to reduce the risk of a cyber attack? And Richard, why don't you kick us off with that question?
Well, yeah, I think the report you mentioned there is fairly indicative of the problems that we're facing across the healthcare industry globally. We have a lack of certified, qualified, or experienced talent in the cybersecurity space, and that is perhaps better manifested, or the example is perhaps no more better manifested than in healthcare, where we are chronically understaffed in terms of the size, magnitude, and depth of the cybersecurity teams that we have. And that is partly because of a historic underfunding of cybersecurity in the healthcare space. And it's partly because healthcare doesn't pay the sort of salaries that other industries pay, and therefore it's difficult to attract and retain top talent. But I think there's a bigger question here, and that is one really around the levels of automation and orchestration within our current security tool sets. We are adopting a very manual, labor-intensive approach to securing our hospitals today, and it requires a lot of resources. And we could probably do better if we had tools that seamlessly orchestrated security for us. So we see, for example, an anomalous activity on the network, and then based upon the runbooks that we've sat down and planned out, we take an action automatically via software rather than wait for a human to intervene. And this is where I think that we're being outdone by cyber criminals, because they're waiting. They're not exactly sitting around waiting for a human reaction to a problem. They're taking that in action as an opportunity to slip into our networks.
That's pretty awesome. You have to think as well that the bad guys, they also make this a business. So ransomware is a service, and they have call centers. I mean, so they probably put in more hours than just your average Joe. So Tim, do you also have a response to that?
Well, when you think about the skill gap that is just broadly true for all security professionals across many industries, it's certainly magnified in a system where you're paying less wages than you might at other high security regulated companies. But my big concern is combining that with some of the advances we've seen in artificial intelligence. And if you think about the misuse of that technology to launch attacks, the attack and threat landscape that we may see 3 years from now will be much, much different. And we can no longer really afford to respond manually one by one to incidents, because you'll be getting thousands of incidents per minute, maybe thousands of incidents per second to respond to, and you're going to need to automatically respond, which is what Richard said, but I'll just 10x that by using artificial intelligence as part of that equation.
Yeah, AI is hot, and I'm sure you hear that term often, especially since ChatGPT went live, and AI, we can't get enough of it. So let's talk a little bit about looking at security loopholes for devices and also legacy systems that can't be upgraded. We know certain hospitals and healthcare organizations may not, stay up to date with the security vulnerabilities, et cetera. Now, are there particular types of systems that are more vulnerable than others? Tim, you mind answering?
Sure. And I'll just say it's kind of a tricky question. For instance, a lot of healthcare organizations still rely on mainframes. Now, for better or for worse, there are probably fewer hackers targeting their efforts onto mainframe technologies and may not even be aware of vulnerabilities in that space. It's just less studied. But let's just kind of advance the thinking a little bit. First of all, I in some ways I reject the question. Everything can be upgraded, and probably you have to think much harder about that than you did 10 years ago. But if you choose not to upgrade, if you choose that critical system is going to stay where it is, whether that's 70s, 80s, 90s, or today, you can choose to create a facade around it, meaning you have it in a protected realm, and the only communication in or out is something that can provide a secure service to the external ecosystem. It's an expensive proposition. It requires its own large outlay of budget to kind of create that system, but it can help insulate you from some sort of toxic infrastructure. But ultimately, in the end, you really do need to excise that, and there's no better way to do that than begin the process of upgrading routinely, regularly, not waiting until you're 20 years behind.
Yeah, I think you hit a really good point there, Tim. If we look at some of the major healthcare breaches, they've been caused by lack of sustained or regular investment in IT infrastructure. A classic example would be the Irish HSE that got hit by Wizard Spider a little while ago, and obviously the NHS, which got hit by WannaCry back in 2017. Those both resulted in their various public health authorities coming in and stripping out 20-year-old, 15-year-old pieces of IT equipment, right, that were end of life, were no longer supported, wouldn't run the latest operating systems, and obviously were absolutely crushed by the types of attacks that were leveraged against them. But I think we need to look at things in the healthcare space from two perspectives. We need to look at the IT infrastructure landscape, as you talked about there, but we also need to look at the healthcare IoT or IOMT infrastructure landscape. 75% of connected assets in today's hospitals are not managed by IT. They're managed by a mixture of clinical engineers, biomedical teams, lab personnel, physical security, and facilities. And that includes everything from medical devices that diagnose patients when they come in, X-ray, CT, PET scanners, ultrasounds, these sorts of things, to devices that will treat patients, radiotherapy, chemotherapy, infusion pumps that will pass a drug to a patient over a period of time based upon the programming of the drug library, to patient telemetry systems, monitoring and management systems, to pharmacy robots that select drugs and pass those drugs to transportation robots that then take them to the various sides of the hospital where they're loaded into Pyxis cabinets and then dispensed to individual patients. We've automated healthcare now to such a degree that we're totally reliant on these things. And if we look at things like building management systems in our hospitals, they are absolutely critical to workflow, and they are connected, whether it's lifts and elevators or whether it's HVAC, right? We couldn't have survived a pandemic disease like COVID without negative air pressure rooms to prevent the spread of pathogens to our clinical staff throughout the hospital or to other patients. We couldn't perform operations unless we had positive air pressure rooms like ORs, so that we could perform surgery in a clean room, right? So these things are absolutely critical, and that's putting aside, the security, the physical security appliances that we're relying upon in our hospitals to keep people out of the OR, proximity door locks, CCTV cameras. We now have an absolute morass of different systems that are connected to our healthcare networks to facilitate this digital, highly interoperable industry as it is today. And we haven't yet really come to grasp with how we're going to manage all of these devices, right? You talked about enclaving, about isolating some of the legacy IT equipment there, and that is absolutely vital. If you've got something that's no longer supported by the vendors, then it probably should be enclaved and essentially locked down so that it can only communicate to systems that are utterly required. But at the same time, we need to do that to the morass of medical devices out there, which were never designed to be secure. They were designed for their functionality. Many of them were never designed to be connected to a medical network. They were standalone devices and have since been upgraded. And a lot of those devices are not being regularly patched. And hopefully that will change for new devices from October 1st this year under new FDA regulations. But it's not going to solve the problem of the millions of legacy devices we have across our healthcare system, which are going to be around for the next 15 or 20 years.
All right. Well, that was a lot. I definitely learned something in that. And I want to get back to the audience, make sure, I don't know if you agree or disagree with anything that Tim said or Richard said around legacy systems, maybe needing to be upgraded or not needed to be upgraded. So I'm sure you may have some systems out there, and maybe you have a question that you'd like to ask. So please don't be shy, jump in and ask a question. Also, what tactics should healthcare organizations adopt to better recover in the event of a cyber attack? Richard.
I think it comes down to planning and preparation, right? I used to have conversations with ministers of health and hospital CEOs who would tell me, what's the probability of my institution being attacked or my health system being attacked? What is the likelihood? Is it likely to happen during my tenure as CEO, or can I, put off that investment in cybersecurity down the road by 3 years, knowing that I will have retired by that point? I think the question is now not one of will I be attacked? It's a question of how often I will be attacked and what level of damage will I need to, or will I likely sustain as a result of attack? So we need to be planning less about preventing attacks and more equally across, the NIST CSF, the NIST cybersecurity framework, for example, looking at the response and recovery aspects of that security model, planning for response and recovery, making sure our security incident response, our business continuity planning, our disaster recovery capabilities are well practiced and intuitive, to the extent that your recovery teams, if they have to look in the manual to see what the next step is, they're probably not fully trained, right? And that includes the entire executive management team of a hospital system, right the way up to the board of directors, so they know what to say to the press when the press comes calling, to your PR teams, to your legal teams, to your compliance teams, and obviously to the guys on the ground who are getting you back up and running, right?
Yeah, I love that. And Tim, I'm going to come back to you in just a minute, but I have a question from Anton. And he wanted to know, has hospital groups started to look at IoT management systems? Can you answer that, Tim, or maybe Richard? Not sure which one of you.
I'll take it.
I think that's a Richard.
Okay, yeah, I'll happily take that one. Yes, they have. We have a number of regulations that are cropping up around the world. In the UK, they have the DSPT, the Data Security Protection Toolkit reporting requirements. And when a new vulnerability is discovered in a medical device, and they're normally medical devices, but they could be other connected assets, hospital trusts need to respond to NHS Digital or NHS England with their exposure and their risk remediation plans within a set period of time. And that is helping to drive security and management of IoT systems. In the US, we're obviously driven by different regulations, but it's something that a lot of hospital systems have jumped on, and something that we at Cylera have been spending a lot of time and energy around automating the management of IoT using machine learning, deep learning, other forms of AI in order to orchestrate the security remediation of risks that are discovered.
All right. Thank you for answering that question, Richard. And Tim, what tactics for cyber attack do you?
Richard said it best: practice, practice, practice. You don't want to learn on the job how to recover a large-scale environment. And so with that in mind, one of the things I always encourage customers to do is really have a good map of where their data lives. Because in order to get critical applications back up and running, you just really have to know. And I'll say that a lot of companies, even well-intentioned, thorough companies, start to lose track of where all that critical data is. And if it was kind of hard to keep track of it 3-5 years ago, think about the number of entities that have adopted software as a service or quickly migrating to public cloud. It's difficult for IT to know where all the data really truly is for a critical application. And I've actually been part of recovery scenarios where the customer is desperate to get a certain database up and running, and really they restored the wrong machines, not once but twice. And it's just a simple matter of they didn't know where the data was because it was installed, configured, and set up 10 years ago. And it's only been maintained and upgraded since, and no one sort of re-architected the thing they were desperate for. So the institutional knowledge left the building a long time ago. So have a map. Where is the data?
Yeah, you hit on a great point there, Tim. And I think hospitals in particular have a lot of legacy data and a lot of legacy systems that transcend multiple generations of systems admins and data owners, right? So it's important to understand who the data owner is, who the data custodian is, and all the other data type that we need to look at. But it's also important to look at not just where the data resides, but how much duplication of data you may have on a hospital network, because data sets will be pulled off and used for research. They'll be pulled off and used for application tuning. In the case of AI, for example, they'll be pulled off and used in many different ways. So we need to look at a deduplication effort prior to trying to respond to an incident, so we know where the true data is. But we also need to know where the assets are. And that's the big problem around medical devices, is that most hospitals have at best, a rudimentary understanding of what assets actually connect to their networks and where those assets may reside on the network, not just, physically, but also virtually in terms of their VLAN assignments.
Mm-hmm. All right, man, a lot of great information. And I hope everyone in the audience is gaining some insight here. And also, as we begin to wrap up here, Tim, I know you recently wrote a blog on improving your security posture with MFA or multi-factor authentication. And we also have that linked below in the show notes. And so any closing words on that or anything else, Tim?
Well, we've come out with a list of 7 different recommendations we're strongly making to anyone in the practice of data protection, backup, and recovery. One of the simplest ones is implementing phishing-resistant multi-factor authentication. We're seeing a trend. It's not just a trend that sprung up yesterday, but the last few years, where attackers no longer get in solely through some obscure vulnerability or zero-day attack, they're logging it. It's because they're stealing credentials, and that's part of their practice. And that means your administrators need to present something other than a password. And that simple way to do it is multi-factor authentication, ideally with a system that offers dynamic challenges and that is phishing resistant. So that is a huge key to making sure the right people get to make the right administrative choices in your environment.
All right. Nice. And Richard, it's also been a pleasure to have you on. You are such a wealth of information. Do you have any final thoughts or resources that you would like to close out today? And I know you have a new book published.
Well, it's not out yet. It comes out. Comes out 21st of August. It's Digital Health Entrepreneurship, second edition. The first edition came out in 2019. We've actually built out the book substantially since then, and there's a new chapter in there looking at cybersecurity for healthcare entrepreneurs. And in it, I talk about artificial intelligence, IoT security, medical devices, and a lot of the technologies that we're going to see in the next 5 to 10 years across healthcare, including things like precision medicine, right? Personalized medications that are going to drastically improve the efficacy of treatments that we use in order to keep patients happy, healthy, and safe.
All right. Well, good luck with that book, and I can't wait to read it myself. Also, we have a 2022 research report on securing your enterprise in a multi-cloud environment. So please be sure to check out that document and download it as well. And also, as we close out our second season of shows here at Veritas Live, I want to remind everyone to check out our playlist on YouTube. So we are on YouTube, and this is where you can reach all of the previous Veritas Live episodes. And also make note, we are offline on July the 4th. I'll be by the pool, maybe a beach. I'm hoping you would do the same. But join us again as Veritas Live returns in our third season on July 25th. Now, until then, stay secure and back up often. Thank you.